Hey everyone. What I wanted to cover on this week's video blog was the 4 reasons for us to use questionnaires in our practice and why I think they're really beneficial. Before we get into that, what I wanted to do was ask you if you like these videos, if they're helpful, please subscribe to our page, please like our page. That helps us keep the messages coming. And also share this information with your friends on Facebook, via email. It's really helpful for our profession to understand the value of our knowledge, education, and training. And I'm hopeful that these videos will help us achieve that. So as we get into this, we'll talk about the 4 reasons for us to use questionnaires in our practices. I use them in my practice for a couple different conditions or different kind of overarching types of conditions. What we're going to talk about today is mainly for ocular surface dysfunction and the reasons I think, the really important reasons I think that they benefit our practice as well as our patients. So the first one is for us to establish history of present illness. So I'd be remiss if I didn't talk about the reasons from a billing standpoint that it's helpful for us to use standardized questionnaires in our practices. And so this is an example of speed, and the speed questionnaire really allows us very quickly to assess 4 different areas. So if we think about our HPI, our history of present illness, you've already got your 4 levels or your 4 elements of history of present illness. So if I were to ask about 2 other review of systems, do you have dry mouth? Do you have joint pain? And also 1 past family or social history. Have you ever taken Accutane, for an example? And I added those 3 questions to the bottom of this speed score and sort of customized speed for my practice. And already I would have a level 4 history for an established patient in our practice. So I often get the comments for people that they could never get more than a 99213 in terms of a follow-up on a dry eye patient. And that's actually not true. And I don't think that those 7 questions, the 4 from speed and the 3 additional that I talked about, would be excessive in any way for us to be evaluating a patient with ocular surface disease. Now, of course, a level 4, so a 99214, is also predicated on, if you're just using history for an established patient, you'd also use your risk, which we can talk about in other videos and we can talk about in other educational content. That's not really the goal of today, but I wanted to just show you that for history of present illness, using a really good standardized questionnaire, you can get a level 4 history really, really easily without a lot of effort, and it's completely legitimate for the care of that patient. So if we look at the next reason, I like the standardized questionnaires because they correlate to clinical signs as well as quality of life scores. So in the blog, as always, we have the links to these studies, but there are 3 studies that we talk about. And the first one is that as OSDI decreases, so symptoms of ocular surface disease improve, we'll also see that quality of life scores improve as well. So I think that's important because it establishes the fact that ocular surface disease or dry eye can impact patients' quality of life. The other study that we cite in this week's blog is that OSDI and speed are really correlated well to one another in terms of symptoms as well as signs. So as overall general symptoms improve, obviously OSDI and speed will improve, and signs will improve as well of ocular surface disease. When we also think about meibomian gland dysfunction, as meibomian gland dysfunction improves, speed scores will correspondingly improve. And so the third reason for us to use ocular surface disease questionnaires and questionnaires in general is that they allow us, if they're really well designed, they'll allow us to establish certain severity aspects. So we can classify patients into mild, moderate, and severe. And the last reason is for us to monitor treatment. So again, if we can stratify patients based on their severity, we can also monitor treatment over time. And so we know that if their symptoms are improving, likely their signs are improving as well. And that shows us that their quality of life overall is improving. Now, you're still going to look at signs with your clinical evaluation, but I think it's important for us to be able to say, to reflect back over time to say, this is what our scores were initially, and here's what our scores are today. The main reason I find that's helpful is that in patients with ocular surface disease, what happens so often is, first of all, the reason that it's hard for them to tell you how bad the condition is at first is that they don't realize how slowly the condition progressed. So they don't realize what it's like for their eyes to feel normal. And the same thing is when we're monitoring treatment, we tend to make improvements that are relatively gradual. And so it's hard for them to realize what they were doing or the way that their ocular surface was making their eyes feel before you started treatment, as opposed to now. They don't necessarily remember all the things that they were going through before. Well, a well-designed questionnaire will help us tease those differences out. And I can tell you, a lot of times I'll ask patients, how much improvement do you feel? And they'll say, well, it's about 10%. And then you look at their scores on their questionnaires, and they've improved by 50, 80%. And it's really helpful for me to be able to look at that and show them. And they realize, oh, wow, this is what my score was before, and now it's here. And that can be very, very helpful, especially early on in treatment, within the first month or 2 months of treating ocular surface disease. And so in our practice, what we use is speed. I like it because it's fast. It doesn't take the patient very long to score for themselves. It's easy for our technicians to score. And it also highlights some of the symptoms that come with ocular surface dysfunction that is evaporative. And since we know that about 86% of patients who have ocular surface dysfunction have some component of that ocular surface dysfunction that is due to poor evaporation or increased evaporation, that allows me to kind of hone in on some of those symptoms. Again, the citation for that statistic is in the blog for this week. So I hope this video was helpful, and I will see you on the next one.